Does acid reflux affect your life like many other vets out there? Well, let's take a look to see if we can turn that symptom into a service-connected condition. Let's get into it.
Whiskey 9 Yankee 7 November Golf, over.
Gastroesophageal reflux disease, aka GERD. It's one of those conditions that affect many vets, but not a lot of vets actually claim this condition. It's very important for you to understand some of the symptoms that are associated with GERD outside of just acid reflux. So, what is GERD? GERD occurs when stomach acid flows back into the esophagus. This can irritate the lining of your esophagus, leading to discomfort, heartburn, or acid reflux, and sometimes even worse conditions. So the question is, how will the VA be rating your GERD? Let me start with, if you are trying to look up GERD in the 38 CFR, you won't find it. It is not actually listed as GERD. It is listed under 7346 as hernia hiatal. So looking at the 38 CFR for hernia hiatal, it has a 10% rating, a 30% rating, and a 60% rating. Let's look at each rating and kind of discuss what's going on here. So with the 2 or more of the symptoms for a 30% evaluation of less severity, that's at 10. So really to even get 10, we need to look at 30. So persistently reoccurring epigastric distress, so onset of gas, with dysphagia, prosis, or regurgitation accompanied by substernal or arm or shoulder pain, productive of considerable impairment of health. So really what that's talking about is continuously burping, that acid reflux that we're talking about, all of those things on a very persistent basis. That includes vomiting. So let's go ahead and look at the 60%. Symptoms of pain, vomiting, material weight loss, and hematosis or melanin with moderate anemia or other symptoms combination productive of severe impairment of health. So this one is in pure language. Basically, if you have persistent pain, vomiting, weight loss, this will qualify you for 60%. So let's go ahead and talk about GERD as a secondary. As most of you understand, GERD can be a secondary to mental health conditions such as PTSD. This is because a lot of the SSRIs that you take, which is medicine for your PTSD or other anxiety, depression, so on, such as Zoloft, can actually put you in gastric distress. So because of this, it can actually cause GERD to be a secondary to your PTSD because you have to take this medicine to be able to function with that mental health condition. All right, as always, we need those 3 things, those 3 golden rules. We need that service connection, we need a current diagnosis, and we need to be able to have a nexus to our military service. So if we're going the secondary route, that service connection will be to our already service-connected mental health. We need our current diagnosis, and then we need to be able to say, yes, these things are indeed connected, which will then be the nexus. With these things, it's really hard for you to go wrong with getting GERD service connected. It's all about the evidence and all about how you're going to collect it, highlight specific things such as symptoms, medicine that you're taking, doctor visits, so on and so forth. Be diligent in this collection because this is going to be the moneymaker for you when it comes to getting your condition approved. All right, guys, that is GERD in a nutshell. As always, please like, share, subscribe so that the algorithm can push more information to you that you actually care about. As always, this is Jay with TheCivDiv. Stay strong, stay resilient, and I'll see you later.